bill. So
neutral.
Sure. We'll say that. I could give you a more nuanced answer, but we have stacks of paper explaining our position. The trigger clause differs from the heartbeat bill in that it doesn't take effect until Roe is overturned. So the trigger clause, the intent of the trigger clause, is not to challenge Roe. It's to put in place protections for the unborn once Roe has been overturned. I can tell you 4 other states have passed such language, and there are 6 other states that have pre-Roe prohibitions on abortion that are similar that still stand in law. So Ohio wouldn't be the only one to have that law.
Can you explain how you're going to take money from Planned Parenthood through the infant mortality program?
Sure. So our efforts to redirect money from Planned Parenthood go back 4 years, I think now. Representative Roegner was there with me every step of the way on that. House Bill 298, as I recall. And that bill was pretty comprehensive, everything we had in there. It redirected funds from every federal funding stream, so Title 10, Title 5, everything with the Maternal Child Health Block Grant. We also had in there 3 other funding streams. One was infant mortality, one was breast and cervical cancer prevention project, and I cannot remember the 3rd one, but I could get back to you on that. Those streams are regulated differently because they aren't federal funds, they're state funds. And so where we redirected funds from Planned Parenthood with those federal funding streams, we can actually just say in state law that our state dollars are not going to go to Planned Parenthood. So we don't need to name Planned Parenthood in the Ohio Revised Code, but we can say that no abortion provider is eligible for those funds.
Would that also apply to the new funds that Governor Casey was talking about?
Are you talking about infant mortality specifically? I have only just started reading through the summary of that, but it seems like the funds for that are pretty heavily invested in progesterone treatments, and to my knowledge, Planned Parenthood doesn't provide that kind of medical care. So the answer is I'm not 100% sure.
So how much money is Planned Parenthood getting through these infant mortality grants now?
I couldn't tell you in the most recent budget what it is. We're not talking millions and millions of dollars, though. We're talking about smaller sums of money.
10 grand? 100 grand?
I would put it more in the 100 grand ballpark.
So, and would that abortion provider language affect other potentially hospitals and other entities that get public money that perform abortions?
No, it certainly wouldn't be our intent to do that, but I believe that we crafted the language carefully enough that it wouldn't affect any other providers.
So who would be left to provide that care? If you take it away from Planned Parenthood, who's doing it?
Any of the federally qualified health centers in the state, I believe there's 40 and they have affiliates, so it puts the number closer to 100. Any hospitals that are providing those services. There are physicians' offices that are kind of out in the community doing those things as well. I don't know how many of them apply for those grants, but they certainly are providing that work.
Stephanie, can I just add, last summer I went with Senator Jones, and we did a tour around the state of different facilities and groups and organizations working on infant mortality. Not once did I see Planned Parenthood. We saw lots and lots of other programs that are out working. So I don't think there's any shortage of places that this money can be well spent, and we can be assured that it's being directed towards saving the lives of children and not taking the lives.
Stephanie, I have some follow-up questions. How many abortions are performed between 20 and 24 weeks now? How many are performed using off-label drugs? And how many are performed after a Down syndrome diagnosis in Ohio? So what are the numbers?
You might have to repeat some of those, but I'll start with the first one.
So
between 20 and 24 weeks, I believe it's 173 abortions in 2013. It was 319 total after 20 weeks.
So 173 in that window of 20 to 24.
Right. And I would also like to note that the number of late-term abortions as a whole has been cut in half since the passage of our post-viability abortion ban.
Okay. And then how about how many using off-label drugs?
So I know that there were, I think it's 800 and some using RE46 specifically in 2013. Chemical abortions as a total were 17% of all abortions in Ohio in 2013. So 800 and something of those were RE46. The other 755 were using other drugs.
Oh, okay. And do you have any numbers on number of abortions conducted after there was a Down syndrome diagnosis?
I don't, and I don't really know that there's a good way to track that.
It's not reported.
It's not. On the form that the Ohio Department of Health uses, that abortion providers fill out, every time they perform an abortion, they submit this report. And they have to say the weeks of gestation, what procedure was used, what drug was used, if that's applicable. There's a question that says, is the health of the woman, is she in good condition or other? That's probably the closest thing we could get to, but it does not ask about any prenatal diagnosis or the health of the baby at all.